Welcome. It's good to talk to you again. It is Friday the 24th of April. Now, I always enjoy giving these talks. I don't mind admitting that the preparation can be a little bit hard work, but to actually talk to you is always, I do enjoy that a bit, and I hope you do too, as well as finding it interesting. Now, let's start off with some remarks by the President of the United States. He's a bit like me, really. He tends to think out loud. And I tend to think out loud sometimes, and you can say things you don't really mean. If I've thought about politics out loud, I do apologise. This is not supposed to be a political broadcast by any means. But let's just clarify. Surface cleaners are to clean. Let me see. What do you clean with this? Antibacterial. Surface. This is for hard surfaces, not even for skin. Dettol. This is also for cleaning surfaces and sometimes skin surfaces with that. So antiseptics will kill bacteria. Many antiseptics will kill viruses. But we don't put them on the surface of the body. We have some specific topical applications sometimes that we use. That you get from the pharmacist that are medically prescribed to put on the surface of the body. They're called topical applications. So we do that sometimes. But things that are designed for surfaces are designed for surfaces. And the thought of drinking some of this is just unthinkable. Completely unthinkable. Now, I know this is ridiculous and stupid things to say, but there are cases of it. There was a rumour in Iran, for example, that drinking alcohol would kill the virus, because if you put alcohol hand washes on and it's 60% alcohol, it kills the viruses. So people were drinking alcohol to kill the viruses in their body, which it will not do. It will not do. So don't. It's just so dangerous because people can get the wrong idea on this, and there were many deaths in Iran by people drinking alcohol, some of which was dodgy alcohol. Now, of course, it goes without saying that under no circumstances would you give yourself any injection unless it was prescribed by your healthcare provider. And normally injections are only given by professionals, so injecting things would be quite unthinkable as well. Now, the idea of ultraviolet light killing viruses, if there's ultraviolet light, viruses will be killed by the ultraviolet light on the surface. But again, we wouldn't use that for the surface of the body. And of course, the light will not penetrate into the body, and we can't put light sources into the body. So I hope the bottom line is don't take any treatment at all that your own healthcare provider has not prescribed for you specifically. Don't take something if I say take it. Hopefully, I never say take something. But if anyone tells you to take something, don't take it unless your own healthcare provider tells you to take it. There's no such thing as blanket internet prescribing. That can never be done. But specifically, don't drink or inject any antiseptics, which I'm sure you all knew already. Now, going on to some firmer points. So, I think we've mentioned all that. Topical applications are for topical indications. We've got them on the surface. Surface cleaners are for surfaces. People have died by drinking the wrong stuff. Injections are professionals. Light will not penetrate into the body. No treatments will light up the inside of the body. So that's finished. Right. Now, total number of cases in the world getting on for 3 million now. Official cases. We know it's higher. Total number of deaths getting on for 200,000. Again, we know it's higher. Now, the United States. I'm not going to do a full roundup of the United States, but we know that, unfortunately, it's not going to be long before there's 1 million deaths. Sorry, 1 million cases in the United States. God willing, there won't be 1 million deaths. But already there's nearly 50,000 deaths. So things are still increasing in the United States. But the question is, how much are they increasing? Now, last week on this podcast, we mentioned that Andrew Cuomo, governor of New York State, announced that he was going to be testing 3,000 people for the antibody to get an idea of how much infection there is in New York. So the idea here is that you test. The idea here, you test for the presence of the antibody. That shows if someone's been exposed to the virus, not necessarily whether they've got the virus at the time. but it shows whether they've been exposed to it ever. And the idea is that if you take a random sample of 3,000 people, and it's a genuine random sample of a much bigger population, it should be representative of that population. So it is not unreasonable to extrapolate up to the larger population. This is the way opinion polls work. So, in my country, at the end of every election, you always know what the result is straight away, because the exit polls are virtually never wrong, because they're done very scientifically by selecting the right sample of people. So that's what's been done here in New York State. So results were announced yesterday. So they randomly tested 3,000 people at grocery stores and shopping locations. Now, you can argue if that is truly random, but I assume they've made a very good attempt at this. 19 counties, 40 localities. So it's not just in one place, so spread out. Now, 19.4 million people in New York State. That's the population of New York State. And what these results shown, and get this is what these results show. 2.7 million people in New York State have been infected by the virus, because they found 13.9% of people they tested were positive, not for the virus, positive for the antibody, indicating they'd had exposure to COVID-19. Now, this is quite a hard number to take in, but this is how science is done. You take a representative sample, and 3,000 is a very good sample size. Very often in these election opinion polls, they poll 1,000 people, and that gives accurate data. So 3,000 can certainly give accurate data. And if 13.9% of a random sample tested positive, then that may well mean, we don't know, without doing everyone, of course, for sure, but that would indicate that 2.7 million people in New York State have been infected with COVID-19 at some point. And in New York City, it was even higher. It's estimated to be 21% of the population of New York City. So does this mean that 21% of the population of New York City have been exposed to COVID-19 virus? Well, this would indicate that that is a real possibility, yes. Quite incredible results. I remember announcing, we talked about this a few days ago, and we said we should be able to give something fairly firm in a few days, and this is it. It's come to fruition. So positive cases infected up to 6 weeks ago. It's been around for a while, this virus, unfortunately. Virus spreading earlier than thought. That's what that means. This has been around for longer than we thought in the United States. And we have looked at that through some early deaths that we looked at back in February in the last couple of days. Now, in the New York State area, so we know in the States as a whole, there was, in the United States as a whole, there's nearly a million confirmed cases in the United States as a whole. In New York State area, that is just over 250,000 people have been confirmed by testing. And all over America, there's been nearly 50,000 deaths, but 19,500 of those occurring in New York State. So what this means is, this is the official numbers confirmed in New York State, and that's the official number of deaths in New York State. And that number there is 7.3% of that number there. So that would give a case fatality rate of 7.3%. But we're sure from other parts of the world that it's not that high. But if you work out if you take 13.9% of the population of New York State, which is 19.4 million, that gives you this number of 2,696,600 potential actual infections. So we know the number of deaths is about right, because we can see death. That's quite easy to diagnose. The number of deaths are fairly obvious. There will be more deaths to add to that, unfortunately. But if that's the number of actual infections and that's the number of deaths, that gives us a case fatality rate of 0.72%, which, to be fair, is round about what we predicted. We were predicting 0.6 to about 1.2 last week on this video. So that does make sense. Now, that percentage will increase slightly, unfortunately, because more people will go on to die who are already ill. But if that's the case, it means that New York State is further on in the pandemic than it thought. Now, it doesn't mean to say that it's over. We need 60 or 70% of the population or more to give proper herd immunity. So we're not talking about herd immunity. And let's assume that the 20% of people in New York City have actually been infected. Of course, that means that 80% have not and could still be infected. But really, quite interesting study. Quite an interesting study. And of course, it means that lower case fatality rate, which is good news. And of course, it means that many people have probably had the infection who don't even realise they've had it. They've been asymptomatic. So that was interesting. So what can we say for sure? More people have had it, been exposed to the virus than on the official figures. We can say that for sure. How many more we can't say for sure, but this indicates it could be dramatically more than the number that had been thought about. Is that good news? Well, yes, potentially it is, because it lowers the case fatality rate. And it means a lot of people have had the infection, therefore presumably have a degree of immunity, who have not developed critical illness or died. Having said that, many in New York have. Like me, you've probably seen the videos of hectic, overstretched medical facilities in New York. So that is interesting. More will come on this shortly. My personal prediction is I think this is likely to be true. I think this is likely to be correct because of the good research methodology that has been used. So that's interesting. Now, Italy. I've found some interesting specific information from Italy now. Quite a bit of it's in Italian, but I found an excellent site, which of course, as always, I'll post the link to. Don't take my word for anything. Always check the links I post or check this out for yourself. But in Italy, we know there's getting on for 200,000 cases, 25,000 deaths. So that's known. But there's some interesting data has now been published by the Italian authorities. And as I say, I'll put the link on. So acute respiratory distress syndrome was observed in the majority of hospitalised patients. So most patients, their main problem was breathing difficulties. ARDS was observed in the majority of patients. That's what the Italians are saying. But acute renal failure, what we now call acute kidney injury, normally, quite a substantial number of those critically ill developed kidney failure. So that's quite concerning because, again, treating kidney failure is really an intensive care sort of thing in the acute situation. So very serious illness. So if someone couldn't breathe and they had acute renal failure, you would call that double organ failure, and that's serious. Now, what the Italians call superinfection was observed in 12.7%. Now, this is not a term I use, superinfection. The term I use is secondary infection. I don't know if this is an Americanism. I'm sure some American nurse or doctor will tell me. But we would call it secondary infection. So what this is, when you have one infection, you're more likely to get another. So viral infection of the respiratory tract, as occurs in COVID-19, is going to predispose you to a secondary infection, such as bacterial pneumonia. So I call it secondary infection. Here they're calling it superinfection, but that's what they mean. So secondary infection observed in 12.7%. Now, this is also concerning. Acute cardiac injury, 9.3% of these hospitalised cases. Now, I'm not sure whether that's critical care cases or hospitalised cases. The data wasn't clear about that. But it still means that heart injury occurs in a substantial number of patients. Now, what we do, what I assume, they didn't publish this data, but what we normally do in hospitals is if someone has a heart attack, so part of the blood supply to part of the heart muscle is cut off, that part of heart muscle will start to die. There'll be death of that part of the heart muscle. And chemicals that are normally contained within the heart cells, because some of the cells have died, will leak out and they'll be in the blood. So cells that are normally supposed to be inside the heart cells leak out into the blood. And the more of this that leaks out into the blood, that means the more heart cells have died, the more cardiac damage there is. These are called cardiac markers, and the one we normally test for is called troponin. So we test for troponins. So I assume what the Italians have done here is tested for troponins and found it's present in 9.3% of cases, indicating cardiac damage. So we're seeing the organs that are affected here: lungs, kidneys, heart. So not particularly good news, but borne out by quite accurate Italian data now. Antibiotics were used by 84% of patients during hospital stay. Now, why were these patients given antibiotics? Let's be clear, antibiotics will not kill the virus. Antibiotics kill bacteria. But what they're saying here is 84% of people must have had some superimposed bacterial infection, or they were worried about it and they gave the antibiotics to prevent it. So we do this quite often. If someone's severely ill, especially with an acute respiratory viral infection, it's quite likely they're going to get some secondary bacterial infection. So it's not unreasonable in hospital to give antibiotics to prevent the bacterial infection before it starts. Because once the bacterial infection gets hold in the lungs, the person can become quite ill, they can become septic and they can die. So it's quite reasonable to give prophylactic antibiotics, and that looks like what happened in most of these Italian cases, because we know secondary infection was only in 12.7, but 84% were given antibiotics, which is presumably as a prophylactic, which is fine. Now, less use were made of antivirals. So interesting, the Italians aren't putting a lot of faith in the antivirals, so only 56% of patients were given antivirals. So that's interesting. So quite a few patients, they weren't using antiviral drugs. Now, to be fair, we don't know these are effective because we haven't had the full clinical trial data yet. But sometimes there's what's called compassionate prescribing of these things, these antiviral drugs, if you think they're going to work. So that was only done by the Italian doctors in 56% of cases. Now, corticosteroids. Cortico means the hormone is produced by the adrenal cortex, and these and they're steroid hormones. That just describes the chemistry of the hormone. But these corticosteroids are drugs that are given that mimic the effects of the natural hormones from the adrenal cortex. And what these drugs are, when you give them, they are massively anti-inflammatory. So they were used in 36% of cases. So we know that part of the pathology that you get in the acute respiratory distress syndrome is caused by the virus. And we know that part is caused by the body's immunological inflammatory reaction to the virus. So what this tells us is that the Italian doctors gauged that the inflammation was more of a problem than the virus, 36% of the cases. I think that's basically what that means. So there was some use of corticosteroids. Don't know if that's right or not. I really don't know. I don't think steroids are being used very much in the UK, from what I can tell. But that's what the Italian doctors did. Now, as of the 20th of April, where this data goes up to on the Italian website, 238 out of the 21,551 cases, that's 1.1% of positive SARS. So it's severe acute respiratory syndrome, coronavirus 2. That's the virus that causes the COVID-19. So only 1.1% of patients were under the age of 50 died. So deaths under the age of 50 were relatively uncommon. So that is encouraging. So 1.1% of positive SARS corona patients under the age of 50 died. Although, is it really? It's still quite a high percentage, isn't it? 1.1%. So what I think the Italian site is saying here is that of the patients under the age of 50 that got the virus, just over 1% died. Now, 54 of these were under the age of, so that's 238 deaths here, 238 deaths. 54 of those 238 were under the age of 40. And 34 men under the age of 40 and 20 women under the age of 40 died. But remember, this is looking from very large samples. Remember, there's an awful lot of people have died in Italy. The death rate in Italy is 25,000. So we're still dealing with smallish percentages, but it is concerning. But more men than women. Now, of those 54 under the age of those 54 under the age of 40, 38 had serious pre-existing diseases. And the diseases they had were cardiovascular, renal, psychiatric pathologies, diabetes and obesity. So these were the comorbidities. Now 10 people under the age of 40 had no major pathologies, and for 6 there was no data available, making up the 54 under the age of 40. But remember, this is in the context of an awful lot of deaths in Italy. Currently 25,000. So I'll just show you some, actually some good graphics from Italy as well. So this one, from the same Italian site, absolute number of deaths by age group. So we see, thankfully, we can't see anything there. Little tiny bit there, more here, and then we see the number of deaths greatly increasing with increasing age. So what we have here, in red we have women, in blue we have men, and these are combined cases. So in every age group, again, as we've seen everywhere now, this is now completely confirmed, more men than women dying, as these are deaths, remember. So in every age group, apart from the older one here, and we've already said the reason for this many times, over the age of 90, there's more old women than old men still alive, because a lot of the men have died already. So people in their 90s, a higher percentage of those are going to die, but there's less of them left to die. So actually the increase in the risk of death in this age group is greater than in all the other age groups. But because there's less people left in the population, the overall fatality is less. Now, this is interesting. Most common symptoms observed in Sars coronavirus 2 positive patients that went on to die. So 75% had a fever, 72% had shortness of breath, 38% had a cough, 6% had diarrhea. And this hemoptysis, that's the American spelling, but hemoptysis means the coughing up of blood. Median hospitalization times, right. So from median hospitalization times in days. These are patients that died again. So from the onset of symptoms to death, the median time was 10 days. That's quite quick, isn't it? Median time is 10 days. The lag can often be greater than that, but that was the median time in Italy. From median time from the onset of symptoms to hospitalisation was 5 days. Therefore, it follows that hospitalisation to death was 5 days as well. And people that died in hospital that didn't go to ITU died in 4 days, and people that did die, went to ITU and then died in 8 days. And that's not surprising, because intensive care, coronary care can keep people alive despite severe illness for longer periods of time. Now, this was interesting. So I think it's worth going through this, actually, because this was very interesting. Now, most common comorbidities observed in SARS coronavirus 2 positive patients that died in Italy. So what were the comorbidities? So the most common was ischemic heart disease, where there's not enough blood supply getting to the muscle of the heart. This is the most common cause of death from heart attacks. Atrial fibrillation is where the top chambers of the heart aren't contracting properly, giving rise to an irregular pulse. Heart failure is where the heart's not pumping out enough blood and there's a backlog in the circulation. Stroke is where there's a cerebrovascular accident, normally caused by a disruption in the blood supply to the brain, but can be caused by a hemorrhage in the brain. Hypertension is when the blood pressure is too high. Diabetes type 2 is when the blood sugar is too high. Dementia is a progressive irreversible impairment of intellectual function. I learned that definition when I was 18. Dementia is a progressive, irreversible impairment of intellectual function. Right, chronic obstructive pulmonary disease, active cancer in the past 5 years, chronic liver disease, chronic renal failure, people on dialysis for renal failure, respiratory failure, HIV, autoimmune diseases and obesity. So again, this is based on a large number of patients. So these are the comorbidities now we can say fairly definitively that we're worried about as making severe disease and, of course, death more likely. If you don't have these diseases or other chronic comorbidities, a bad outcome, severe disease and death is less likely. That's for Canada. I think I'll show you that later. Actually, no, I think we've finished Italy now, so we'll just do this. We'll move on to now. This is British Columbia. So they've published this dashboard, which I just find these really interesting. Now, this is not all of Canada. This is just British Columbia. But it's good that they've published this ongoing live dashboard that shows the number of cases. Pity the number of cases here seem to be increasing of late. And again, I'll post the link for that. So that's an Australian style dashboard, which I thought was a good idea. Now, don't want that again. Right. So that's good quality data now come from Italy. So that's useful that the Italian government are publishing that. Not a lot of surprises, to be quite honest, about the Italian data, but it's good to get it confirmed. The knowledge of this virus now and how it's affecting people is really starting to firm up. And that's firm data from Italy. Now, the UK cases now increasing. These are deaths in hospital in the UK, so the actual death rate is 30, 40, 50% higher than that. It's a very sad, it's a very sad situation. Now, this is good news. All essential workers offered tests if symptomatic or their family symptomatic. So there's now a way that essential workers can find out if they have symptoms and they can get tested. So if they've got symptoms and they are positive, they would have to be isolated for at least a week and their family quarantined for 2 weeks. But then again, if they don't have the virus, they can go back to their essential duties. And I was delighted to see this includes supermarket workers. Now, supermarket workers are exposed to the public all day and in an indoor environment. Now, what I would like to see, so if there's any supermarket people watching, what we really need at the moment is way better ventilation in our supermarkets. Because the more fresh air is blowing through the supermarket, the more diluted the virus will be. Now, some people that go to supermarkets are going to be carrying the virus just because it's a public place. So the virus will be to some extent going in the air. But the more breeze blowing through the supermarket, the more that virus will be diluted. So can supermarket owners work out a way to keep the doors open and to open the windows or whatever? I know it's difficult in modern buildings, but if you can work out a way to let fresh air blow through the supermarkets, I think that's going to reduce the risk of infection. Fresh air, more through breezes in supermarkets, please. And also, I believe that everyone should be wearing a mask when they go to a supermarket, not to protect themselves, but in case they're infected, to stop them shedding the virus so much onto other people. And of course, products from supermarkets, especially hard surfaces, any hard surfaces in supermarkets should be considered to be contaminated, that you don't want to touch your face. And also cleaning, especially the tops of tins that are coming back from supermarkets and things like that is a good idea as well, the hard surfaces. So we really do need more fresh air in our indoor spaces, and it's warmer now. We can do this. We're not going to freeze to death. So let's have more fresh air blowing through all public spaces, please. And I was also pleased to see delivery drivers now being included as essential. We tend to forget. I mean, if you can't eat, you get really hungry quite quickly. So supermarket workers are absolutely essential. So pleased to see that's happening in the UK. And testing is increasing. The latest news is that we should be on track in the UK to meet the 100,000 tests per day aspiration that we're hoping for. Now, increasing cases in South America, Brazil, Ecuador, more cases and deaths. There's been this appalling denial in Brazil from the political leadership. Peru, likewise, more cases and deaths. So, am I worried about South America? Yes. Yes, that the pandemic is gaining momentum in South America, I'm afraid. South Korea, no deaths in the last 24 hours. That's good news. No deaths in the last 24 hours. South Africa, the president's asked people to wear masks outdoors. Now, I don't think it's necessary to wear masks outside in outdoor areas where we're separated from other people by preferably way more than 2 meters. But any indoor spaces, I agree. So particularly supermarkets and public transport. I really feel that everyone should be wearing masks in supermarkets and public transport. And the lockdown is starting to lift in South Africa on the 1st of May. Now, just a bit of a report from Hungary. Cases and deaths. And this is from my contact in Hungary. We are currently in lockdown. Plan that this will start to be lifted on the 6th of May. So hoping to start lifting the lockdown from the 6th of May in Hungary. Daily case numbers and deaths are not going down significantly, unfortunately. So the lockdown is being lifted for economic reasons, it looks like. Now, this is good. Starting from the 27th of April, you'll have to wear a mask in Budapest when shopping or using public transport. Thank goodness for that. You know, it's such a simple thing to do. If everyone wears masks in supermarkets and public transport, then every infected person will be wearing a mask. It's that simple. But I do believe it has to be mandated, as this is. Let's hope this spreads from Budapest all round Hungary and indeed all round the world. Now, this is interesting. It looks like the Hungarian authorities know that when they start lifting the lockdown, there's going to be more cases. And when the lockdowns are lifted, there will be more cases. So to prepare for this, 56% of the beds have been cleared in hospitals, providing enough beds for the reopening. So they must think that the reopening is essential for economic reasons, social reasons, but realising that that is going to bring more spread. And a minority of people who get the disease are going to need hospitalised. So it looks like they realise that. Testing's a bit difficult, apparently, according to my source. Officially, you only get tested if you have been in contact with an infected person and or you've left the country in the past 14 days. So testing difficulties, I've heard, in Hungary. And cultural matters are so important, so people tend to work even if unwell. So this is a problem. So let me just read you sort of... One of the things we have to do is we have to look at our own cultural activities and work out how our culture is interfering with the disease. So this is my contact in Hungary. My colleague, 30-year-old healthy male, was sent to Germany for around 6 weeks ago. So went to Germany to work. Came back, developed a fever, cough, muscle pain on Friday. So that does sound pretty suspicious, doesn't it? So he's been to Germany. Fever, cough, muscle pain. Sounds like he had COVID-19. Tried to get tested, but he was simply denied because he did not have shortness of breath. No quarantine had been ordered. And then because of the financial reasons, he came back to work Thursday because his fever went down. Still had a headache and a persistent cough. Now, if he had COVID-19, I think it's highly likely he was still shedding the virus at this point. Till this day, nobody was tested, even though in the next 2 weeks there were multiple people with mild symptoms. Luckily, the department has mostly young people, and after a week or so, everyone started working from home. So important that people with any symptoms do not return to normal duties. Now, I've got some of the latest thinking from the World Health Organization here. But before we do that, I'm just going to show you an excellent picture. And this is Nicola from the UK, who's kindly sent this in. And I really do find these quite poignant, that Nicola's invited me into her home. It's just quite amazing, really. So thank you, Nicola, and thank you for the picture and for allowing us to use your picture on the video. It's it's great that I'm invited into your home. Thank you. Now, just to finish today, I'm going to look at a few bits the World Health Organization have been saying. I've left this to the end because I realise that not everyone might want to necessarily listen to the World Health Organization, but they are saying some very interesting, relevant things. Now, the World Health Organization, in my view, have made complete hash up of some aspects of this, but some of the things they say through their contacts are good. Now, this is remarkably concerning. Malaria deaths could double due to lack of nets, antiseptics, killing mosquitoes, anti-malarial drugs, all the things that are normally done because of people locking down because of the COVID-19. And there's already huge numbers of deaths in malaria, from malaria in Africa, for example. So this is one of those secondary effects that's just so tragic. There's going to be more deaths from malaria because malaria has to be actively kept down. You have to kill the mosquitoes. You have to put the antiseptic or whatever they use to kill mosquitoes in the water. You have to use the medicated nets. You have to distribute the nets. You have to make sure people are using the nets. You have to educate people to use the nets. You have to treat the cases. All of these things, and because they're not being done to the degree they're usually done, there's going to be more deaths from malaria. Now, the World Health Organization is saying up to half of all European deaths could have occurred in care homes, which, of course, these are vulnerable people. They're older and they have comorbidities. Therefore, they're more at risk. And basically, we haven't done too good a job of protecting them. I'm somewhat ashamed to say, really. Western Europe cases are stable or declining, but where again that's because of stringent lockdown measures. Increasing cases in Eastern Europe, Africa and South America, which we know. The World Health Organization is saying there's a long way to go. Transmission's been suppressed, but most of the world's population remains susceptible. So most people have not had exposure to the novel coronavirus. It's a novel virus, therefore they have no immunity to it, therefore they are susceptible. And it could well be that it ends up infecting a large percentage of the world's population, especially in poorer countries. The World Health Organization reiterate, find every case, isolate every case, test every case, care for every case, trace and quarantine every contact. And I agree with every word of that. Find every case, isolate every case, test every case, care for every case, test, trace every quarantine, trace and quarantine every contact. That's how we're going to eradicate this virus before we get not eradicate it, but suppress it before we get a vaccine. We need to attack it with the blanket measures from on top, but the individual targeted measures from below, as we've said many, many times. This is why the world needs billions of tests, literally billions. Educate, engage and empower your people. So they have to be told, given the information they need, which is what we're doing now. Engage them, make them realise it's for them and give them the power to do it, empower, so that they need to be done. We have to carry the populations with us. And then the World Health Organization said evidence-based technique, advice, analysis and synthesis was the best science. Now, I just thought that was a bit rich coming from the World Health Organization. Having said we can carry on flying in and out of China when the evidence was clearly, in my view, against that. But it doesn't alter the objective truth of the statement that we need to engage with the best evidence. We need to engage with the best science. We need to analyse the best science and the best data, and we need to synthesise it, bring all those things together to formulate best practice. So they're right, but it just seems a bit rich coming from the World Health Organization after some of the what I perceive to be the major gaffes that they've made. But that doesn't alter the scientific legitimacy of that statement. Well, okay. Bye for now. Bye, Nicola. Hope you've watched. Thank you for sending that in.